Warning, listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
And welcome back to another episode of Influencers Radio. So pain. Is pain an inevitable part of life? You know, it doesn't matter what age, being in pain can be debilitating for many people. It might be as simple as a nuisance pain or as severe as pain that leaves one almost bedridden. The fact is that more than 1.5 billion, that's billion with a B, people suffer from chronic pain worldwide. In the U.S., it impacts about 100 million adults, which is more than the number impacted by diabetes, heart disease, and cancer combined. Well, today my guest is Dr. Derek Taylor. He is a chiropractor with the offices in Torrance, California, and Palm Beach Gardens, Florida, and he has helped thousands of people to find the root cause of their pain. Now, Dr. Taylor is not a crack your bones and go type of chiropractor. He creates a treatment plan customized for each patient, specializing in the hard-to-treat cases with an uncommonly high level of success. He is one of only 2 specially trained worldwide in the Taylor method. Dr. Taylor, welcome to Influencers Radio.
Thank you, Jack. It's a pleasure to be on your show.
Well, I like talking to folks that can bust myths and really kind of redefine what people think about or people, misconceptions that people have. And I know that a lot of people may have some misconceptions about what a chiropractor can help them with. So I'd like to kick this off by asking you what the benefits or the advantages of working with a chiropractor when it comes to managing pain.
Well, I tell my patients, if you have some type of pain or health condition related to that nature or something that you're having a hard time figuring out, come to our office or come see your chiropractor first, because we're going to use a natural, non-invasive, non-harmful method of taking a look at you right off the bat. And if it's something that's out of our scope of practice, then we can always refer to a different specialist that would be working on a different level. So working chiropractically naturally is always, in my opinion, one of the Hippocratic oath that when I graduated from school was, as physicians, is first do no harm. So we're not going to be prescribing any medications that could have a harmful side effect, or performing some type of injection or something that could be caustic or injurious to the body. So with chiropractic, we like to look at you from a holistic, natural approach. And from there, we're able to hopefully figure out what is the root cause of the problem and then take care of that naturally and without causing harm, and then often getting results that are going to be quick and pain relieving and effective immediately.
Well, that's really one of the reasons that I want to have you on this show, because it seems like the default answer to a lot of things is, well, there's a pill for that, right? And just to have that alternative is tremendous. But one of the things is, like many, when I think of a chiropractor, I think back problems. All right. So what are some of the other things that you are successfully treating?
Well, as chiropractors, we're really not back doctors, as a lot of people, and this is what most commonly people associate chiropractic with, is back problems. But we're really keepers of the nervous system. Your nervous system, according to Gray's Anatomy, controls every cell, tissue, organ, and system of the body. So if your body is not functioning properly, is usually some imbalance in the nervous system. So the nervous system consists of your brain, which goes down to your spinal cord, and from the spinal cord, you have nerves, peripheral nerves that exit from the spinal cord and innervate the body. Well, when one of those bones misalign, that can cause that is a subluxation that can cause nerve interference. And when the nerve is not functioning at 100%, then your body's going to know it. manifest with pain or dysfunction or lack of range of motion, or if it's affecting an organ, that organ may not function properly, or whatever it is, your nervous system, since it runs the show, if that's not functioning at 100%, neither will you. And the definition of health is your body functioning at 100%. If you're not functioning at that level, you're not going to be at optimal health where you should be.
Well, I guess in that old kids rhyming, the neck bones connected to the backbone. I guess that has more truth to it than anything.
Yeah, it's something funny that you mentioned that. So, in regards to that, what's interesting with the method that we use, somebody, let's say they come in with back pain. Sometimes you'll have the pain in that back, but it's really not coming from there. It's coming from a different part of the body. And so with the method that we use, we're able to discern where that is coming from, so we're not guessing. And when you can nail the issue that's causing the problem, you can see results, and often very quickly and very effectively and long-lasting.
Well, let's think of like surgeons or all different types of physicians. So when you're talking about a surgeon, a lot of them specialize in different types of surgeons. So when it comes to chiropractic treatment, are there differences between chiropractors and what's the delineation there?
Yeah, well, there's probably over 200 different chiropractic techniques out there. And so you go to a chiropractor. In school, they teach you the basics of keeping to the spine, adjusting the spine, exercise, and diet. And so when you graduate, you have a basic understanding of what to do. But really, there's so many different ways and approaches of adjusting. And over the years, we've developed our own method that is kind of unique to the industry. When I first graduated from chiropractic school, I thought I had the world by the tail and I was going to fix everybody. And, I graduated, I studied hard. I graduated in top of my class and voted most likely to succeed by my classmates. And I was on top of the world. Well, I got into a job. I was working in a clinic in Northwest Ohio where we would see sometimes over 100 patients a day. It was the largest clinic in that area, I think in all of the state. And I was getting people in and out. And what had happened was some patients weren't getting better. In fact, many of them were getting worse. And it was very discouraging for me. And that's what happened to me when I first got into chiropractic. I in high school, I played football, and my junior year I was injured my back playing football, and I went to a chiropractor, and he actually made it worse. And so I was telling everybody, don't go see a chiropractor. But then I went to see another doctor who used another chiropractor who used a different approach, and I had a miraculous recovery. And I was so inspired, I decided to become a chiropractor. So I went from that C student, the goof-off football party guy in high school, to never studying, to a place where in college, that's always just ferociously studying. I became a straight A student. I wanted to be the best doctor that I could possibly be. And so that's all I did was study, and I just wanted to be the best at what I could do. And so I thought by getting straight A's and by learning everything they taught me in school that I would be able to be that successful doctor. But again, as I mentioned, after working almost 4 years at this clinic, I was very discouraged when people weren't getting better, and I moved back to California. The clinic was in Ohio. I'm from California. Moved back to California, and I was so discouraged. I got a job as a part-time teacher, as a teaching junior hires, but then that drove me crazy, and I said, I don't want to do this. And so I realized the problem wasn't chiropractic. The problem was I didn't know how to get results. I didn't know how to truly get to the root cause of people's issues. And so I started going to continuing education seminars and postgraduate courses and following doctors from around the country and even the world that were using different approaches and successful approaches that were able to get results. And over the past 30 years, I've spent over $100,000 just on continuing education courses, and I and trying to get to the root cause of people's problems, I picked and chose the best methods and approaches that these doctors use, and the stuff that I didn't like or think wasn't beneficial, I threw it out the side. And over the past 30 years, I've developed my own technique called the Taylor method. That is a very unique method of discovering the root cause of people's problems. And then on top of that, we've invested in hundreds of thousands of dollars in the latest technology that is able to get results that I just can't get with my hands, results that are just astounding in regards to helping to manage and reduce and even eliminate people's pain altogether. So we have a very unique approach to looking at the person and treating them holistically using this method. And you combine that with the technology, and again, the results are sometimes phenomenal.
Well, I'm going to go back to the beginning of that story because it just really struck me as how remarkable, what passion can spark. You talked about being that C student party into to having something, but that just also speaks to how what an impact pain can have on someone's life to really drive them to that. So, and one of the things that really stands out about you is what you mentioned, that Taylor method. And I'd like to dig a little bit deeper into that, if you wouldn't mind. Can you talk about that and kind of in terms that anybody can understand on because I think it's really critical for folks to understand how important and how unique and valuable this method is.
Yeah, well, let's take it at first. When I first graduated from chiropractic school, you're taught a certain protocol and standard to treat patients. And so when people would come in, they say, oh, let's say I had a neck pain. I have a neck pain. Okay, great. You would focus on that neck. You would adjust the neck. You do therapy on the neck. You do massage on that neck. You do exercises for that neck. And then hopefully something would stick and work, and that would resolve the patient's problem. Well, that's a mechanistic, mechanical viewpoint and perspective on treating the patient. The Taylor method is different, that we use more of a, some people call it intuitive, some people call it more holistic, some people call it more well-rounded approach, where we're using, we do the full intake of the patient's history. The history is very important, finding out what's going on there with that. And then using certain diagnostic tools in our exam to figure out what's going on, and looking at it more from a 30,000-foot viewpoint rather than at a grassroots level. I'm not getting caught in the weeds of just looking at the neck. We're looking at the whole person. And when I say whole person, we're looking at all the different types of stress that bring patients into the office. Now, when people think of stress, they just think of mental or emotional stress. But there's actually 4 types of stress that lead people into our office. The first is physical stress, and that's typically what people come to see a doctor of chiropractic for. The physical stress meaning that vertebra out of alignment is putting pressure on the nerve. But we go beyond that. We really address the muscular component to that, and that is the adhesive scar tissue that often gets embedded in the muscles that's in the surrounding areas. Those areas are often neglected and not treated, and that's what's pulling the bone to go out of place in the first place. And then when you have that scar tissue, it also creates imbalances there in the nervous system. It creates imbalances with blood flow, with vascularity, and these can be referral trigger points in scar tissue that are referring pain to different parts of the body. So we love to properly address that scar tissue using our method to find out where that's coming from, and then once we find it, then we have the tools and the different approaches to address it and to take care of it. So my patients have told me before, wow, 2 minutes with your Taylor method and taking care of the scar tissue was 10 times more effective than getting an hour and a half massage, just doing a whole body massage, or even just focusing on that area, because that's a general. And I love massage. Believe me, everybody loves a massage, and it's wonderful. I think I'm a big promoter of massage. It's great for general overall wellness. But if you're trying to fix a certain condition, that certain pain or condition is tied in with certain adhesive scar tissue that's stuck in the body that needs to be addressed. And so with our method, we do what it takes to take care of that scar tissue and resolve it. So that's the first stress, physical stress. The second stress is chemical stress. Now, what do I mean by chemical stress? Well, that's the foods that we're eating, the beverages that we're drinking, the pills that we're taking, the environment that we're exposed to, the mold that there may be in our house that we're breathing in, we're not even aware of it. So there's chemical stressors that can affect the body that can actually contribute and lead to pain. Not just pain, but just sickness and illness. And when your body's in a state of dis-ease, then that's going to cause more subluxations and cause more physical stress and cause things to tighten up as well. So, and a lot of times people are eating foods that are inflammatory, that their body doesn't agree with. And that's causing things to tighten up and cause pain. So we love to be able to identify what are some of these chemical stressors. You can eliminate the scar tissue and take care of the adjustments, but if they're still eating foods or doing things that are causing things to go out of alignment, there's going to be a continual problem for them. So they have to clean up their diet. You are what you eat. And by taking care of that nutritional component and eating the right foods, that's going to provide nourishment to the cells so that the body can heal and repair itself. So there's physical stress, number one. Secondly, there's chemical stress. Number three is the mental stress. The way you think and what's going on with your mindset and how you look at life, and that can have a huge impact on your overall health. So as you think, that's who you are. And so if you're if you're constantly in a negative state of mind, that in itself can affect the body and harm it in many different ways. And when you're thinking wrong like that, that can affect the emotional component of your body. And there's been lots of studies showing that how emotions can they can kind of get stuck and trapped in the body. So when these emotional components take over some people and they've had some type of experience or trauma, they're not looking at things in a proper way, then that can negatively affect them and impact their health, and to a point that can lead to pain and discomfort and problems. So we have a unique method of getting to the root cause of that and taking care of that issue as well. And then lastly, so we have physical stress, chemical stress, third, mental stress. Fourth is the EMF stress. EMF stands for electromagnetic fields, and that's from the 5G towers that they're just placing everywhere. The increase in technology, all the cell phones, the Wi-Fi, your computers, your printers that are on wireless, the ceiling fans in your room, the digital clock by your bed. All these things are creating subatomic chaos in the body. And there's over 10,000 studies demonstrating how EMF stress has been linked to poor health and to different types of diseases such as cancer and Alzheimer's and autoimmune conditions. And if you go to bioinitiative.org, it's a website filled with scientists that have no agenda. They're not getting paid any particular money but they're just putting out the information and education out there for people, knowing that this EMF stress is causing lots of problems for patients: headaches, sleeplessness, insomnia, hormonal challenges. And so we have a way of figuring out how the EMF stresses are causing issues for people, and then we have a method for remediating that in people's homes and offices. If you start to address all these four stresses and start taking them out, if you start to eliminate them, you're going to see some miraculous and huge shifts in your overall health, where you're just going to experience just a lot less pain, more energy, greater health, and it's going to get to the root cause of a lot of issues that people are struggling with.
Well, I have to say, I think you just demonstrated why you're, considered such a leader in this field, because, you dig deep, far beyond what a lot of people think of cracking the back, right, to fix things, and just the fact that you go well beyond that, even the physical part. And I think these stressors are things that is probably highly ignored or neglected by a lot of medical professionals, for sure. So one thing that I would like to really dig into and understand the difference, because we hear a lot about pain management, pain relief. Like I said earlier, there's a pill for that. And I think a lot of people don't understand, the harmful effects even over the counter pain medication can have. So when we hear pain management, to me, there's a big difference in managing pain versus eliminating pain or even relieving pain. So is what you're doing, do you find that it's, and don't get me wrong, I think a lot of people, their goal is I just want to feel better, right? Not necessarily eliminate pain, but is what you're doing, how often do you see that it really can be classified as pain elimination?
That's a great question. When people think of pain management, it's usually a specialty within the medical profession for medical doctors, that if patients have a chronic pain, they just can't get rid of the pain, they go to the pain management clinic. It's different from going than the orthopedic clinic or a neurologist clinic. No, it's designed specifically for pain management and to decrease this and manage the symptoms of pain. So they'll give an injection or some type of pharmaceutical to help reduce and control that symptom of pain. And people don't know where to turn to. I mean, when you have pain like that, you're desperate. You want to do anything that's just going to be able to help get your life back. And so that's pain management. We're really not shooting for that. I mean, when somebody comes in with pain is just your body telling you that you're not healthy. Pain is a symptom, and a symptom is an indicator of your body's telling you, hey, there's something not quite right here that I want you to address. You need to listen to me. I'm trying to get your attention with this pain. I need you to take care of this. Otherwise, I'm going to keep nagging you like a nagging spouse until you take care of me. And that's what pain does, right? So pain is we need to look at pain as like our friend telling us there's something else going on. And so our job is to find out what is the root cause of that pain. And ideally and optimally, we want to get people to function at optimal wellness, because if you're experiencing and enjoying optimal wellness, you're not going to have any pain. Pain does not exist in somebody who's a vibrantly healthy person, right? If I'm hitting on all 8 cylinders and I'm doing well, I'm eating right, my body's in balance, my mind is in balance, I've reduced all these different stressors as much as I can in my life, and I'm taking good care of myself, you don't really see really healthy, vibrant people with the pain. And if they do, that's their body just saying, hey, this area here is not quite right. So if you can figure out what is causing that and dig a little deeper and get to the root cause of that and address that issue, you'll see the pain not just managed, but actually eliminated altogether. And so it's possible. Now, here's the challenging part. You can show up with a pain today you didn't have yesterday. And so people will come in, they'll say, hey, I had a lady last night. She couldn't sleep on her side. And so she came to see me because she'd been struggling with this for a month. And she said, okay, I've had enough. I keep taking Advil and this is not working. And I've tried this, it's not working. So she came to see us. Well, we after the treatment, when she left, she was absolutely pain-free. I texted her this morning to see how she was doing. Slept great last night, no pain. I'm so happy, thankful. But that itself, I'm so happy that she is better. And our goal is to get people out of pain as fast as possible. That's one of our goals. We want to do that for people, and that's one of my aims. This is why I've invested so much in, my education and getting to this place of helping people. But she really had a lot of different issues that are going on. 35 years ago, she was in a car accident and was never properly addressed. Major scar tissue was developed. She was telling me all these other symptoms and problems that she was having, and the pain was just simply the tip of the iceberg. So for some people that want to get rid of pain, or they want to minimize or reduce their pain, then we can do treatments for that, and that's great. That's fabulous. And we just tell people however you want to be served, we'll serve you in whatever capacity. And so, but ideally, if she got to the point where she was saying, hey, this is an indication something else is going on, I need to work on these other areas, I need to start incorporating these exercises, I need to start changing my diet, I need to start making some changes in my lifestyle, I need to start reducing these stresses, that would be far greater for her, because in the long run, she can get to a point where pain is not even a thought in her mind. Now, she was out of pain and she's pain-free today, but how long will that treatment last, and how long was that really going to resolve things if we don't really get to some of these other root issues that are so deeply embedded into her overall health? Now, I don't know. That treatment could last a day, could last 3 days, could last 3 weeks, could last 3 months, could last 3 years. You don't know. But look at pain. People need to look at pain as, hey, their friend just telling them there's something else going on here. Why don't we address some of these other issues? The real goal is not pain relief or pain elimination, but the real goal is optimal wellness. I mean, you want to be living in your 7th, 8th, 9th decade, being able to pick up your grandchildren, go to your grandchild's wedding, being able to be active with your spouse and go on trips. You know, so many times people, they work all their lives to retire, and then they have all this money and they have all these plans to travel and see the world and to, you know, enjoy this time together, but they can't because they've not taken care of their overall health. They've not invested in they may have invested in the stock market, but they haven't invested in their overall health to get to that place where they're functioning at 100% and enjoying optimal health and good health, and not worried about disease or getting sickness or, coming down with cancer or having heart disease or being surprised like that. But hey, no, I've made these investments in my overall health. That's no guarantee. We never know when we're going to go, but I'm working towards I want to live at that higher level, higher quality of life, and higher confidence that, yeah, my health is, I have confidence that my health is going to be at an optimal level, and I am functioning the way that I want to and enjoying the quality that I'm supposed to be doing. So I don't know if that answered your question, but that's kind of a long answer. We're looking at optimal wellness, which is inversely proportional to pain. The higher you're functioning at that level of optimal wellness, the less pain that you have, and vice versa. The more pain that you're in, chronic level of pain that you're in, the less healthy that you are. And it's your responsibility to figure out what that is and take care of that and make the changes so that you can live at that level of optimal wellness.
That's such a powerful, powerful perspective that you laid out there, because it seems like, we've just become so accustomed to treating symptoms and that quick fix versus treating that root cause, and just that analogy that you laid out about, it is an investment in your health, and how quickly, sometimes, people, that's just not talked about. That is all the focus is on relieving those symptoms. And I think that's really what makes what you're doing truly remarkable. One thing I'd want to address is, a visit to a doctor, for whatever reason, creates a lot of anxiety for a lot of folks. So can you walk us through what a Taylor method exam is like, just to alleviate some of those fears that people have and anxieties they have about visiting a doctor? What can they expect from that?
Right. Well, when people call our office, first thing we do is we ask, would you like to come in for a new patient exam, or were you interested more just in a free consult? Some people, they're not even sure. They've never been a chiropractor before. We offer free consults, so we'll have them come in. We'll get a brief intake form, that one-page intake form, kind of getting the gist of why they're there. They'll come in and they can check the office out. They can meet us. They can meet the staff. And when you step into an office, that this is right. I'm at the right place. Or they may step in and say, you know what, I don't really feel comfortable being here, and I don't feel like this is the right place for me. We like to offer that for people. because we're not for everybody. We're not. Some people are not accustomed to this approach, this philosophy that I'm describing here, and they're more used to just taking, and that's okay if they're at that level. So we offer that free consult. We tell them when somebody comes in, the first thing I'll say is, look, after hearing them out, sometimes right off the bat, I can say, this is beyond our scope. You really need to go to the ER. You need to go see this person here first before we see you. It'll be a better use of your time and money. And we send them out right off the bat. If we do consultation, I think this looks like a chiropractic problem. This looks like this is something that we can help you with. Then we can do an evaluation here for you. We can do an exam. And our exams, we for some people, they just want to focus. They're used to the chiropractic in and out. Just check my spine and do that. We offer something like that for them. It's a low-cost initial evaluation and just adjustment. Even using the Taylor method to figure out where to adjust is going to be much more effective than just getting a whack and crack where somebody's just adjusting everything, doing the same routine on everybody. Every time that somebody comes in, they get a custom-made treatment, whether it's a custom adjustment or a custom full Taylor method session. It's going to be customized, and they're going to leave feeling better. We never let anybody leave our office who's not feeling any better. Oftentimes people leave at least 20% better. Sometimes they feel 100% better, depending on how much work we do on them. But you're always going to leave better when you come to the office. Now, going back to that initial free consult, after the free consult, they say, okay, I met you. I like the office. This feels right. Let's go ahead and see the next step and do an exam. So we'll do a Taylor method evaluation. So if they do something more comprehensive, we'll do more comprehensive tests. We'll take the time to really sit back and go back to their past history to see what are some of the contributing factors that are led them to this point at this time. We'll take x-rays if we need to in our office. And then at any time, if I can't figure out what's going on, if I sense there's something, this is just not right, we'll send them out. There's no charge for the exam, and we'll send them out to an appropriate specialist or somebody that would better be able to treat them and suit them. If we do the exam, and again, I said if we can't figure out what is the root cause, again, we just tell them we're up front with them and say that I can't find out what's causing this, and that's happened sometimes. Sometimes people have something that's beyond what we can do, and we'll send them out. There's no charge, and we send them to a specialist that would better be able to take care of their needs. And this is, you asked the question earlier. Remember, Jack, and earlier in our podcast, you said, what's the benefit of seeing a chiropractor? This is why it's better to come to see a chiropractor who's using this type of approach, because if it's beyond us, we'll let you know, right? We don't want to, the worst thing, our reputation is more important to us than anything else. And so we would never want to take on a case that we didn't feel like we could help, or we didn't know where the problem was coming from, because we don't want to take somebody's money and not get them the results that they're hoping to achieve. But once we do the exam and we are able to, let's say we are able to find the cause, then we'll bring you back and we'll give you a report of findings. We'll let you know, in our opinion, exactly what's causing the problem, where it's coming from, what you need to do to resolve it, what it's going to take, and how much it's going to cost. And at that point, people can decide whether they want to follow through, or they start a plan of care, or they may want to think about it, but at least they know I've done my job of telling them where the problem is coming from. Sometimes I'll say, hey, it's coming from here, here, and here. You want to find somebody that knows how to work those areas? By all means, go to see them. You wanted to know what the problem was. Here's my professional opinion, and this is what I think it's going to need to take care of it. And then we just let them choose how they want to proceed. If let's say they do decide to go with the plan of care, at that point they start the plan. Usually they'll get results even in that very first visit. They're going to feel better, and with each successive visit, they're going to feel better, and to the point where they're going to get the results that we said that they were going to get. And if they don't, then there's something else that's missing. There's something that's not been addressed. And there's something else that is contributing to that problem that needs to be taken care of. But we'll pretty much know within the first week or two the pathway that we're going. And then at the end of that treatment plan, they'll be at that level typically where we told them that they were going to be. And sometimes for some people, the pain is gone altogether, or sometimes that's 50% overall, 70%, 80%, 90% better. And then we'll talk about what the next step is if they want to do some type of maintenance and following up and doing some type of routine care. It's like your lawn, right? Somebody comes to a lot of times people, they come in a wreck. They've neglected their body for years. They haven't been eating right. They haven't been exercising. They're out of shape. They're out of alignment. They got scar tissue everywhere. They've abused their body. And they say, help me. It's like somebody who has lived in a house for 20 years and they've done nothing for their front or backyard. And it's just overgrown with weeds and it's a disaster. And you bring in the landscaper, they come in and they make it beautiful, right? That's what we do that's what we seek to do with people's health. We turn something that's not very not functioning well and not very, it's not giving them what they were hoping in regards to the quality of their life. And we turn that around so that they're able to enjoy life again. But once they've gotten to that point, or just like the gardener, the landscaper gets your yard looking beautiful, if you don't maintain that, what's going to happen to your yard? You continue to neglect that for another 10, 20 years, it's going to look like it did when the landscaper first came. Same with the health. Once you get to that level of care, if you follow through with the exercise and the maintenance and periodic, tune-ups that we offer, then they're going to stay at that level. So does that make sense?
It does. And you do such a fantastic job of setting expectations. And I think, hopefully most people know there's a difference between, a chiropractor and a magician. And I think that, one, you do, provide some amazing results, but also setting those expectations is so important, which leads me to ask, you mentioned massage earlier and how great, people can feel after massage, but the reality, sometimes right after a massage or the next day, you could actually feel a little bit sore, especially if you got a really good. So, what are some of the things for the setting expectations of, how people feel, directly after a treatment and how they would know if the treatment's working?
Well, here's the thing. When they come and they experience a Taylor method session, they'll know the treatment's working. If they couldn't sit for more than 10 seconds without pain, when they leave, that's going to be less, or that's going to be improved, or that might even be gone sometimes. So you'll know that the treatment is working. Now, in regards to the next day, how you feel, I tell people this. Look, we have technology that is phenomenal. I mean, you talk about a magician versus being realistic. The reality is we have some technology that makes us look like magicians, or makes me look like a magician. We have a pressure wave technology that almost acts like a cortisone shot, where you get results where you feel pain relief instantaneously. I mean, it's phenomenal when you use this right. And so people can typically, they're going to feel better when they leave here. And so now, in regards to the next day, I tell people this. Look, I have people come to me from all over the state. So when we were practicing in California, I had people from all over parts of California. We had people from different states. We have even people internationally that will come see us because of the method that we use. And so if somebody's coming to me from a long distance, I will tell them this: look, you're coming, hours away. And so I don't have the convenience of seeing you twice a week. I don't have this convenience of seeing you when I need to. Some people are so bad they may need to be seen daily. If they're in a major car accident, they want to get better quicker. So if that's the case, the more that we work on you and the deeper that we go and the more aggressive that we do our treatment, the more sore you're going to be later tonight or the next day. But the results 3 days from now are going to be, you're going to be more aggressive. You're going to pay the price over the next couple of days. You're going to not like me because you're going to be so sore. But by the third day or so, you're going to love me, and it's going to be so much better as you're going to feel the difference after that soreness and that inflammation has gone down. Does that make sense?
Yeah, it does. And I think that's part of the, those expectations, I think, is one of the things that really, is a big difference, because, that short-term discomfort in exchange for those long-term benefits is an easy trade-off.
Yeah. And doing this for almost 30 years, I can touch somebody's body and I can know how much they're going to be able to handle. And so I'll have a pretty good idea. So I will maybe take it easier. Sometimes people, they don't need as much. They don't need as an aggressive approach. They need something, they need to ease into it gently. And sometimes they respond better with that type of approach. Other people, they can handle more, and they'll be able to, they want to get better faster right away. And so they're on a time crunch. They're either an athlete that needs to get back into the game, or they got some event or tournament or something going on that they have a deadline on when they want to get better faster. Well, then I'm like that accountant around April 13th. I'm working feverishly to make sure that deadline is met, and we're going to get them to the results where they want to be. So it all just kind of depends upon the patient. Sometimes people, for some of the treatments that we have, especially with the pressure wave, it can be uncomfortable. And so there's some people that they don't want to experience any pain with the treatment. No problem. We can accommodate that for you. We can do a painless treatment. It's just going to take more visits to get the job done. Does that make sense? It's like my 14-year-old daughter recently got some braces. So, if she wants to have less pain in the teeth, the orthodontist doesn't tighten it quite as much, and she's not quite as sore. It's just she'll have the braces on longer. But if they can treat a little more aggressively, and you're more results oriented rather than pain, not having any discomfort oriented, then we can get you there faster. But there's some people that, hey, I don't care how long it takes. I just don't want any pain with the treatment. I want it to be I want minimal discomfort as possible. Great. We can do that type of treatment as well. We can customize it. The patient's always in control of to what level that they're comfortable with.
Yeah, it's remarkable that those types of nuanced incremental options are available for that it's not all or nothing all at once.
Right. Well, I've been able to do that is through all the mistakes that I made over the past 30 years. I've been to some of the most incredible, I've learned from some of the most incredible doctors in the world, but actually the best teachers that I've had have always been my patients. They give me the greatest feedback, whether positive or negative, in regards to helping me, get to the level of service that we are now in regards to helping people with their health.
Well, that experience certainly brings a value that just can't be duplicated or implemented. It just takes the time to do that for sure. One thing that I wanted to ask you as we've been talking about this, I'm thinking of, joint pains, muscle aches, that type of things. But one thing that I know a lot of people suffer with is migraines. How does this apply to something like that, to migraines? Is it available, and does it work well for that?
Absolutely. I mean, when it comes to migraines, I mean, can be a very complex type of headache to deal with. You're dealing with hormones, you're dealing with food sensitivities, you're dealing with emotional stressors, it could be a number of different stressors that are contributing to the migraine. And so what makes sense more to you, Jack? I have a migraine. I'm going to come to you. Here's some Imatrix. This will help lessen the migraine. That approach versus you have a migraine, let's go see the doctor. Okay, what's causing this migraine? Oh my goodness, what are you eating? You're eating gluten, you're eating cheese you're drinking wine. Do you realize that every time you have that piece of cheese, that's going to trigger the migraine? Do you realize that you have a subluxation here in your neck and your atlas that's putting pressure on that nerve, and that's shutting down the blood flow to that neck area, and that's causing that? Do you realize that this stressor that you're going through at work with your boss, you have not dealt with this? You need to get in the right mindset here with this. You realize that you're holding on to this bitterness and unforgiveness toward this person that has wronged you. And you need to let that go. We need to work on, let that, not be an issue here for you anymore. Do you realize that you just had a 5G tower put next to your house that's like a mile away? And ever since they put that up there, the EMF levels that are affecting you when you're asleep, along with that brand new iPhone that you have, that you're sleeping next to your bed without it being on airplane mode, is contributing to these migraines. Tell you what, let's start knocking out these stressors, which are not only causing a migraine, but it could be causing other challenges and problems with your overall health. Let's start taking care of those, and let's see about getting you back to the place of optimal wellness. And when you are, you won't have the migraines. And so you take that approach, and then you combine that with our tailor method approach of figuring out exactly where the imbalances are in the body. And then in addition, you're going to use technology that'll normalize that sometimes get rid of the headache instantaneously, whether it's a laser or the pulse electromagnetic field therapy that we use, or the neuromed or the vibrasonic, or the whatever that we're using to get rid of that and get to the root cause. A lot of times people leave with that headache at least 50% better at that time, or completely gone. It's amazing what happens when you just get the body in balance. We're not headache doctors. We're just doctors that get people back into balance. And when your body's in balance, God's given the body an amazing ability to heal itself, and sometimes just like right there on the spot. It's just amazing. So migraines, there's a lot of docs that I talk to, fellow chiropractors, they hate treating headaches because they're a headache. They're a headache to treat. And the reason why is because if you don't really know exactly what's causing the headache, you're not going to be able to resolve it. And so if you can get to the root cause, you can resolve it. And the healthier you are, the faster you respond. I remember this one kid, mom brought me to the kid. He was like 15 years old. He had headaches all his life. So mom brought him in. We started doing treatments. Day 1, no change. Day 2, no change. We did like 30 days worth of treatment, maybe a little bit better. Probably around the 5th week, boom, his headaches were completely gone. Now, in this case, this is one of my oddest cases. No matter how much laser we did and everything we did, it only made just slight changes. However, we started working with diet. We started working with exercise. We started working with the scar tissue. He had so many layers of stress in his body that it took that long for him to get to the point where he was completely headache-free and fine. And so that's sometimes how it works. The healthier you are, the faster you're going to respond at the office, and the faster you're going to respond with your care. So think of your health as an investment. Your body is think of your body as your checking account. We have all of these stressors, the physical stress, the chemical stress, the mental stress, the EMF stress. Those are all like withdrawals in your checking account. When you start putting deposits in your health by, getting chiropractic care where you're balanced out, making changes in your diet, eating more greens instead of gluten or dairy, and then getting the right mindset and letting some of these issues go and just getting the right frame of mind, and then reducing the EMF stress in your home and in your office, that's adding deposits in your account. And so when you have a healthy account, you're going to be having a higher quality of life. You're going to be happier. When you are constantly taking out deposits and not you're constantly taking out deposits from your account, and when withdrawals from your account and not putting any deposits, you start to go in the red, right? In regards to your account, the bills start to back up. You have creditors knocking on your door saying, "Hey, you need to pay us for this," but you don't have any money in your account because you're bankrupt. You're devoid of finances. It's the same with your health. People, they run their lives and drive, and they're constantly taking all of these withdrawals with all the physical stress, the chemical stress, the mental stress, the EMF stress, and they're not doing anything to put a deposit in. No wonder they're bankrupt. No wonder their body's screaming at them because they're in so much pain. No wonder they're at a place of dis-ease and having some types of health challenges that they just can't get rid of. They're so depleted because they haven't put any deposits in, and they've done nothing but just taken withdrawals. And so we like to help get people to the level where we teach them and educate them and pour into them so they are putting deposits in, and they get to that level of optimal wellness, and now they have a big, fat, healthy bank account with plenty of reserves, and they're not worried about when something bad happens, or there's a unexpected bill, or there's some setback here or there. Hey, no problem. We got plenty in our reserves. We can take care of this. That's the same with your body. The more the healthier you are, the faster it's going to respond to care. And like sometimes people, they may feel like they're coming down with a cold. If you're healthy, sometimes you may not even have a manifestation of that cold. You may feel a little punky for a day or two. You may feel like you are, you're coming down with something, but it lasts for a few days and then you're fine. It never turns into a full-blown illness. And that's what can happen if you're healthy and functioning at that type of level. Does that make sense?
It does, and I got to say, it's you're certainly a rare breed, and it's easy to understand why people travel links to be able to take advantage of this, because I don't think it's very common for people to have a anthropologist, psychologist, ergonomicist, all wrapped up in a chiropractor, the way that they have with you. So do you oversee all of the treatments for your patients, or do you have people that you've trained in this to be able to give this kind of a very special attention to your patients?
Yes, we have a team of physicians and therapists and help that will assist us. It takes a team approach. I couldn't do this without our team. This is really not about me. It's about our team just providing people the level of care that they're looking for to receive. So I'll often meet with them initially, and our exam doctor will start with the evaluation process, and I'll oversee kind of the whole thing, kind of manage it, kind of like a general contractor. Have you ever had your house remodeled, Jack, or an office? So you have your general contractor there. He's not doing all the work, right? So he will have other people come in and kind of do their portion, but he'll oversee them and tell them, make sure you do this, and this. But a lot of times there are some people that they only want to see me. So we do have a concierge type practice where if they want to just see me exclusively, we offer that for people that want that type of level of service, so they just feel like they only want to work with myself. But you're going to be able to get the same results whether you're just seeing me or you're seeing our team, because the technology does work for itself. The technology, it works no matter who's doing it, because it just gets that kind of results, and then we know where to place the technology, and so the results are very consistent. And people, whether it's myself or somebody else working on them, they're going to get great results when you start to take care of these stressors.
Well, Dr. Taylor, I have to say that you just it's been a treat having you on the show. You do truly have a gift for not only implementing this stuff, but explaining it so that people can understand and feel very comfortable with, what their options are. So I want to thank you for coming on today and sharing this. So how can people find out more? If they want to find out more about Dr. Taylor, they want to find out more about the Taylor method and how to get involved, what can they do?
Well, they can go to our website, www.drderektaylor.com. That's DRDEREKTAYLOR.com. And if you're closer to the West Coast, you can reach our office there in Torrance, California. And if you're closer here, more in the East Coast, we also have another office in Palm Beach Gardens, Florida, that you would be able to visit. My son, Dr. Hudson Taylor, he is the other person trained in the Taylor method, and he does a phenomenal job. In fact, he adds such a a new insight coming right from school with all the latest things that they're teaching in school. And we've combined. He's joined the practice 2 years ago, and working together, we've combined to enhance the Taylor method and to provide a level of care that you just can't find anywhere else. I mean, we talk to people, and I always ask them, have you ever received a treatment like this? And of course, the answer is always no, just because nobody has worked at this level of really discovering the root cause. But Dr. Hudson operates the office in Torrance, California, and I'm the one overseeing the office and operating the office here in Palm Beach Gardens, Florida. So you can see us at either location.
Well, fantastic. Again, thanks so much for coming on and sharing this. It really has been eye-opening. It's
been a pleasure. Thank you so much for having me on your show.
All right, folks, definitely check out drderektaylor.com. That's Dr. DREKTAYLOR.com. We'll have a link right there on the show post. And until next time on Influencers Radio, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today.